Welcome. This is the mini lecture on Sbar. You will need your student notes to follow along during this presentation. Sbar is an organized method of collecting and reporting data about your client or patient to usually the physician. It can be used with other disciplines. You will be required to use this method of communication in the simulation lab for this course. What it stands for is situation, background, assessment, and recommendation. We're going to look at each of these four parts with a little bit of detail. On the day that you come to class, you will need to bring the practice exercise with you, and we will actually do it in class in small groups. Situation is exactly what it sounds like. It's what you're calling the physician about. You're going to tell him who the patient is, who you are, what's kind of going on in a nutshell. It is very important during this process that you always identify yourself by both first and last name and title. There may be a lot of Lauras or Ashleys or Mikes or Toms on a unit, so it's important that you tell them your last name. It is also important that you differentiate that you are a registered nurse. That sets you apart from perhaps a respiratory therapist that may be calling the physician, a licensed practical nurse, or some other member of the healthcare team. So these elements will be required in your communication in the simulation lab as well. So the situation is simply what happened. Why is this person here? And I gave you the example. We're going to follow through, and that's Mr. Altered Mental. Yes, that's altered mental. So, hello, Dr. Duguid. This is Laura Glidewell, RN on the neuro floor, and I am calling about Mr. Altered Mental. Now, already right off the bat, I've set the pace. I've made sure that I've got the correct physician, in this case, Mr. Dr. Duguid. He knows who I am. He knows what unit I'm calling from, and he knows who the patient I'm calling about. You never identify patients by room number or curtain number or anything such as that. Now I'm going to follow that up by letting him know that Mr. Termental is a 66-year-old dementia patient. He was admitted last night from the ED. Do you think that's important? Actually, it is, because there's a big difference in what may or may not have happened for the patient, whether they were a direct admit or whether they were admitted through the emergency room in terms of data and data collection. So you always want to let them know, how did this person wind up on your floor? And then lastly, what was his admitting diagnosis? He was admitted from the ED with a diagnosis of hyponatremia and seizures. Okay? That just kind of sets the stage, if you will, for what is about to come. Now we move on to background. And background is exactly what it sounds like. It's what happened in the past. It's what brought the patient here, what led up to them being hospitalized. Did they have nausea and vomiting for several days, and that's why they are dehydrated and hyponatremia? Or is it because of their dementia that they're not eating and drinking appropriately? You know, what happened? Do they have a history of seizures in their past that would have made them more prone to seizing because they had a low sodium level? So you got to kind of paint the picture for the physician. You want to be concise, but you want to make sure that you include pertinent information. And if you look at your next slide in your handout, you'll see that I gave you the example. Mr. Termental had a history of dementia and has been forgetting to eat at regular intervals. He also has been leaving home for several hours and not drinking. We all know that dementia patients are at risk for this. His other medical diagnoses, things that happened in the past but are certainly going to play a role in how he gets better, include diabetes, coronary artery disease, and prostate cancer. On admission, his serum sodium level was 129. So that gives him that very vital piece of background information. We told him he had hyponatremia, and now we have backed it up with a level. And in this section on background, it's a really good idea to include your admitting vital signs so that he has something to compare to when you give him your current assessment. Is the patient getting better or is the patient getting worse? And here I've listed your admitting vital signs. You'll notice that this low blood pressure and this tachycardic pulse rate are consistent with dehydration. So everything is tracking. Now, assessment. This is where we do the current data. So if you're following along, you might want to underline the word current. Assessment is what's happening right now. Why are we calling him? Obviously, he came into the emergency room with these problems, but they have done something about them. So what are we going to call him about? When we are doing the assessment, we can say to the physician what we think may be going on, but we cannot diagnose the patient, because that would be outside of our scope of practice in the state of Florida unless you're an advanced registered nurse practitioner. Here is the example. Currently, right now, Mr. Tremental has an IV running of normal saline at 125. His vital signs are. Now, are those vital signs better? Yeah. He has a pain scale, the 5th vital sign. He is lethargic but does arouse. He remains confused but calm. Now, the fact that he's confused may or may not have anything to do with his sodium at this point, because we're replacing it. Instead, it may be his dementia, but we don't know. So it's still important to let the physician know that. His AM labs show his sodium is getting better. He's up to 131. Still not normal though, is it? But his potassium is low, and his monitor is showing a PVC, or a premature ventricular contraction, every 4th beat. I think he needs to have his potassium replaced as well as his sodium based on the frequency of his PVCs. I didn't say what was wrong with him. I did not come out and say he was hypokalemic as well, because hypokalemia would be the medical diagnosis. I simply made a intelligent leap between this lab value and this assessment finding to make the recommendation, which is the R, that we need to replace his potassium. So again, I can make the suggestion. I can say to him that I think we need to do this. But anytime you make a recommendation to the physician, you had better be ready to back it up. You had better know why you are asking for that. What is the rationale? For the purposes of this class, anytime you do Sbar, you'll need to make at least 2 recommendations, and one of them must be a medication. Okay, you will have to do this on an exam, and so you want to make sure that when you write this out for your exam that you make one of those recommendations a medication. For medications, I will take anything that was included in pharmacology, which means fluids, electrolyte replacements, blood or blood products if that's appropriate, and medications. I do not count off for spelling, but you do need to start getting, common medications and their spelling down pat. Phenergan is PH, just for the record. No, just kidding. Here's your example. Would you like to have pharmacy add potassium to the IV fluids? Mr. Tremental is taking PO, so perhaps some Cater as well. Also, I think we should repeat the potassium level this afternoon after he has had his potassium dose initiated, say 4 hours later. Now, in real life, you wouldn't have to worry about this example because it would be covered under the electrolyte protocols for your facility, but it was an easy example to follow. And then lastly, you have got to make sure that if the physician gives you any orders, that you read those orders back to them, and you note that on your MAR as a read back, and you need to clarify with the physician under what circumstances should I call you back. And I know it sounds really minor, but you want to be able to document in your notes that you have asked that question and you are clear on when you should call the physician back. You must write this on your exam or in the sim lab when you call them out. So as a recap, Sbar is an organized system of presenting data to a physician or other team member in a clear and concise manner. It allows you to have readily available everything you need to have when the physician needs it. So make sure you have the chart in your hand when you call him in case he wants labs or diagnostics that you don't have. It does elevate your standing as a professional because it shows him or her, that you have your act together. And it allows you guys to collaborate and come up with a correct answer for the patient. This concludes the Sbar portion.